Men and women in law enforcement are sworn to protect and serve you every day. However, many say it's a dream job that can be demanding on your mental and physical health, especially in small towns. And tonight in my Closing the Gap, I traveled to Adams County Sheriff's Department, where they're shining a light on the problem and working to provide solutions.
Yeah, everything's good.
These deputies work for the Adams County Sheriff's Department, and it's no secret they love their jobs.
Absolutely. We're considered, quote unquote, the superheroes.
The deputies deal with a lot of stuff, and they see a lot of things that the general public they just don't see.
But they do admit protecting and serving their communities can be tough and taxing.
Just what you see every day and what you have to deal with everybody's problems, and still deal with your problems as well. Law enforcement's not what it was 25, 30 years ago.
According to the Substance Abuse and Mental Health Services Administration, it is estimated that 30% of first responders develop behavioral health conditions, including depression and post-traumatic stress disorder.
You'll go from a dog barking call to a double homicide. I mean, then you'll have to leave that double homicide and go to a horse loose call. I mean, you go from one thing to another, and it's a variety of things, and you have to be able to deal with it as you go, you know.
Law enforcement as a whole has always had the stigmatism of not wanting to talk about problems, not wanting to talk about issues, and we tend to take it home. And that's one of the reasons the divorce rate's so high within law enforcement.
And here's some more alarming statistics. According to the National Alliance on Mental Health Illness, nearly 1 in 4 police officers has thoughts of suicide at some point in their life. And the suicide rate for police officers is 4 times higher than the rate for firefighters. And more police die by suicide than in the line of duty. In fact, in 2017, there was an estimated 140 law enforcement suicides. And in the smallest departments, the suicide rate for officers increases to almost 4 times the national average.
Aside from the normal job itself, the mental, the physical, the emotional aspect of not knowing what you're going to encounter day in and day out, your own personal things that you deal with, your spouse, your girlfriend, your husband, kids, and the things outside of the job, and being able to balance it all and just try to live an everyday life is extremely challenging.
But even with the challenges and the exposure the job takes on the mental health of law enforcement, help still tends to lag, especially in small and rural communities where resources and manpower are scarce.
That could be a problem because your mind's not on what you're doing. So you need to be able to make the right decision, and the only way you can do that is your mind be right.
We're facing a crisis on the street. Law enforcement is facing a crisis on the home. They're facing a crisis when it comes to pay, but yet we're asked to do more and more and more each and every day. People want us to pour out, but nobody's really pouring in. Hey, fellas, how y'all doing today?
Sheriff Travis Patton agrees when mental health help is overlooked, this can produce dire consequences. So to help close that gap, he has revised policies and implemented programs to provide a more supportive culture for his agency, starting with a peer support service.
Sometimes they just need a shoulder to lean on, talk about, and get some things off their chest. Peer support allows that to happen. They can go to their peers who have been trained on the local, state, and federal level in peer support, have the confidentiality in place where that peer support person doesn't come and report to any of us, but if they feel like they need to take it further and get them more assistance, that peer support agent will do that on the spot.
And the sheriff also says thanks to the assistance from the county, his office pays the copay for those wanting to get some extra help and sit down with a counselor.
We're very thankful for the insurance that we have because it'll pay, it pays for the sessions, but it doesn't pay for the copay. So as a sheriff's office, we pay for your copay. We don't want you to have any reason why you can't get the help you need for whatever situation you deal with.
Another layer of help is at their fingertips.
We have this wellness app on all of our cell phones that has a plethora of different types of help that you can get and remain anonymous. A lot of times when those people committed suicide, they were alone in their room. Well, that app helps them not to be alone. You can just pick up your phone and find help counseling for whatever you need. And me as sheriff, I don't even have to know about it. You're getting the help in the privacy of your own home where you don't have to deal with being ridiculed or things of that nature.
These men hope the state will also step in and provide more support.
I wish that they would do two things. One, that the crisis intervention training would be mandatory for all officers. And then two, every so many years, if they don't have a mental counselor available to them, that they have the ability to go and talk to them, and maybe even make it regulated once every 5 years or 10 years if it's something that's not being done from the very get-go. And the same way with the critical incidents. If you're involved in a critical incident, you need to go and talk to somebody.
As Sheriff Patton and his team believe changing the culture in law enforcement
Let's walk over here.
to enforce positivity and wellness will have a ripple effect on those wearing the badge and the people they are protecting.
The decisions that law enforcement are having to make every day at the drop of within a second. You're having to make decisions that are going to affect you, affect other people. And sometimes those decisions you can't take back once you make them. And if you're not in the right frame of mind out here doing the job, then that could be a bad thing.
How you doing? We have been changing the culture here at the sheriff's office where people understand that it's okay to go lay on somebody's couch. It's okay to receive the counseling, because this mental health is just as important as the rest of your physical health.